Spotlight, presented by Community Health Network.
Health officials are redefining heart disease, announcing the development of cardio-kidney metabolic syndrome, or CKM, easy to say.
Yeah, officials say it's not a new disease, but 1 in 3 people are at risk of developing it. In today's Health Spotlight, News 8's Brittany Noble explains why experts say it's a new way of thinking about how existing conditions affect one another and how we should be treating them.
I have this syndrome. I was kind of sad that I did.
Dr. Jay Haywood looks at hearts all day long and never thought he would be taking a closer look at his own.
I have high blood pressure. My weight could be better. I don't have any cardiovascular disease, but I have some of the beginning parts of this. And probably 100 million people in the United States have some degree of this.
He's talking about cardio-kidney metabolic syndrome, or CKM. It's an overlap between kidney disease and metabolic disorders like type 2 diabetes, obesity, and heart disease.
This is actually a healthcare emergency that we don't treat these things in isolation, but we treat them together.
It's a new way of thinking about the domino effect that just one health problem can have on your entire body.
Obesity, high blood pressure, high cholesterol, renal problems all come together to make each other worse. They're like a dysfunctional family, and when they're all together, they really make things worse, and they tremendously reduce life expectancy for patients.
CKM syndrome ranges from stage 0 or no risk factors to stage 4 with cardiovascular disease and kidney failure. Dr. Haywood believes naming the CKM syndrome is as much for doctors as it is for their patients.
I think it's a call to action to all of us to look at the patient more holistically and address more of their problems.
And by doctors working together, hopefully patients will get an earlier diagnosis and life-saving treatment. I'm Brittany Noble, reporting for Wish TV, wishtv.com, and follow us on Facebook for updates.